Nakikipag-usap na si Pangulong Bongbong Marcos sa Department of Health kaugnay ng pagpapatuloy ng State of Public Health Emergency hanggang Disyembre. Sabi ni PBBM, posible yang ipatupad habang pinaghahandaan pa ang tuluyang pagbawi sa deklarasyon. Marami raw kasing tulong ang nakukuha ng bansa mula sa international health community ngayong nasa ilalim tayo ng State of Health Emergency. Kasama na riyan ang pagpapatuloy ng bakunahan kontra COVID, pati na ang pamimigay ng ayuda. Kaugnay ng balitang yan, makakausap natin live via Zoom si dating Presidential Advisor for Entrepreneurship at Go Negosyo founder Joey Concepcion. Magandang umaga po sa inyo, Sir Joey. Ano po yung masasabi ninyo dito po sa kakadeklara lamang ni President Bongbong Marcos na posibleng ipalawigin hanggang December yung State of Public Health Emergency?
Magandang umaga rin. So, tama rin yan kasi kahit sa tingin ko pwede na talagang tanggalin yung public state of health emergency. Yung problema natin itong mga bakuna natin, no? Na may plano tayo bumili. Eventually, sabi ni Yusik Reset na ang supply natin tamang-tama for the entire year. Pero ang tingin ng private sector, kung papasok kami at tutulong dito para bumili ng mga bakuna para sa mga empleyado namin, mas maganda bilhin namin yung mga bagong vaccines na gives you enough protection against Omicron. So, as the public state of emergency terminates in September at kung iuso nila sa the end of the year, okay rin yan. At least, ang problema natin kasi itong mga vaccine manufacturers, we don't know how aggressive they will be in filing for certificate of product registration. Importante yan para at least yung mga pribadong sector, pwede nang ibenta yung mga bakuna dyan sa mga drug stores, no? Katulad ng ibang flu vaccines. Pero kung medyo may delay dyan at hindi pa sigurado yung mga vaccine manufacturers na ang direction nila ang CPR, then there is no choice but for the government to to extend the emergency use authority for these vaccines as well, no? So pushing it back to the end of the year, I think is the right move because of the vaccinations that we want to purchase, no? And that's dependent on what direction will the vaccine companies take. File for a CPR or wait for an EUA, no?
Okay. Sir, para lang po mas maintindihan ng mga kababayan natin, kapag po kasi meron tayong public health emergency, ibig sabihin, pwede pa po nilang makuha ng libre yung bakuna. Tama po ba? And kapag po na-lift na ito, that's the time na pwede na nilang ibenta yung bakuna sa mga drugstores.
Well, it's not really related kasi yung ibang bansa, wala naman state of public health emergency, but they're giving the bakuna to the people, no? But of course, may mga advantage rin ng having a state of public health emergency. It's faster to get the vaccines approved, no? And granting EUA, there are certain things that have to be done. I don't know if Congress will have to be involved here, but if we were to follow what President Duterte did under the public state of emergency, the vaccines were, they had the ability to speed up the purchase of the vaccine. So that's an advantage. Kung bibenta, if the vaccine manufacturers will sell the vaccines here, and then all they need to do, and I think they should do that, is to file really for a certificate of product registration para at least by that time, they can make it more accessible. And those who want to take the vaccines, just buy the vaccines. Now, if the government's policy is still to support the vaccination program of the Filipino people, then they can also do the EUA, no? And I think that is the reason why there will be an extension, no?
I see. Pero kayo po, sir, sa sa private sector rather, willing naman po kayo din na mag-procure uli ng bakuna once na maging available na po ito for commercial use? Because as we all know, ang private sector, isa sila doon sa mga nanguna sa procurement ng vaccine nung kasagsagan ng pandemic to also help the government.
Yes, we were the first ones to buy the AstraZeneca at that time kasi wala pang approval dyan sa UK na MHRA. Katubas natin yan ng FDA. So the private sector, the government cannot buy a vaccine or a drug that has no approval yet, no FDA approval. So what we did, we went and took the risk, and when it was approved, then we were lucky to be on the top slot. But here, I think the good part is this mga bagong dadating na bakuna towards the end of the year are the bivalent. No? Itong may mga protection na yan against Omicron, B4, B5. No? So it's the private sector, I'm not saying all. Some of them had a bad experience dahil sa mga expiry vaccines, but there are some that I was told that are still willing to support their employees, no? And the families of their employees. So walang problema yan. And whatever direction the president takes, whether it is to lift state of public health emergency or to extend it till the end of the year anyway, that's only 1 quarter to go. It's maybe just extend it so that at least whatever way we go, whether it's EUA, CPR, there will be no problem. And if the government will continue to give the vaccines for free, then maybe that's the way to go. And hopefully we start the year, next year in 2023, with the removal of the state of public health emergency.
Sir, vaccine pa rin po. Kamusta na po yung mga bakuna na malapit nang ma-expire na na-purchase po ng private sector?
Well, na-expire na. So we can't do anything about it. At sabi ni, it's done, it's finished. We have no more vaccines. So ang ginagawa namin is we're just bringing our people to the LGUs, the vaccination centers. And so far, medyo matumal pa rin yung the public, no? Kasi they see it as a mild thing. So, but we have a campaign right now, isa pa, para sa nanay. Kasi we're opening up school, no? 27 children will go, just 27 children and youth will be going to school. That's a lot of more mobility, no? That will do good for the economy, no? Because you have now more mobility, canteens, cafeterias, all the sari-sari stores will start to do better. That's 27 million. Malaking bagay yan. But, of course, there will be more infection because there will be more mobility. So we have to take the vaccine, especially those students who are qualified to take the first booster. And karamihan naman doon, 15 years and above are qualified to take the first booster. Dapat kunin nila mga teachers natin, staff, mga school administrators, all of them have to be fully vaccinated. No? And of course, they have to wear masks, especially at this time, na medyo tumataas. Although may mga report ngayon na mukhang nagta-taper off uli ang mga kaso natin. Pero this is how we have to live with Omicron. There is no other way around this.
Sir, pakiulit nga po, gaano nga po karami yung mga na-expire na vaccines from private sector? And ano po ang sabi ng DOH dito? Kasama po ba ito sa mapapalitan mula sa COVAX facility?
Yeah, this will all be replaced according to USEC Rosette, no? Kasama mga binili namin, I think close to, if I'm not mistaken here, 5 million vaccines, no? Thereabouts, no? I know we lost a lot. We lost about 100 million pesos, more or less. I remember the 100 million. I'm looking for it in my notes, no? But yes, and it's already lost. But I hope we just learn from this. I hope the DOH will try to really review anong tama para sa mga committees nila katulad ng HTAC, ng NBOG, ng Vaccine Expert Panel. And I think ultimately the Secretary of Health should be the last decision maker. The Secretary of Health cannot just say, okay, HTAC, bahala na kayo, you make the decision. Or cannot, kung may problema, the Secretary of Health should override the decision of these committees. Now, that's my suggestion. Katulad lang sa private sector, marami rin kami committees, Finance Committee, Audit Committee. But in the end, it's the CEO who decides. So to avoid this problem from happening again, and I also am just sharing this, as early as this year, we've been already calling that the vaccines, we have a lot, the movement is going down. So law of supply and demand, marami tayong supply, yung demand medyo bumabagsak na. Nakikita namin sa private sector. So we have to do something about it. No? And may ginawa naman sila, no? Pero and what we asked them was something practical. Sundin na lang ang patakaran ng CDC tungkol sa mga how you use. So sana naluwagan nila yung booster 2 kasi halos ng mga empleyado namin tapos na sa booster 1. But never mind, this is all the past. Let's move forward and let's learn from this. And anyway, ang ginhawa natin dito, bukas na ang economy ng Pilipinas.
Alright, sige po sir. Maraming salamat po sa inyo, Go Negosyo founder, Joey Concepcion. Thank you sir.